Thanks, everyone. Thanks for joining us on this Wednesday. Welcome to our members of the media, and for those of you who are joining us online or watching us on television. Today, Orange County Mayor Jerry Demings will discuss stopping the spread of the virus as we examine increased COVID-19 numbers and comment on the COVID-19 situation at Orange County Corrections and an adjustment to one of his executive orders and much more. Mayor Buddy Dyer is here from the city of Orlando. He will discuss mask wearing in the city, as well as an update on testing at the Orlando Fire and Police Departments. And of course, we have Dr. Raul Pino from the Florida Department of Health here in Orange County. He has information also on our increased testing numbers, and he will have other information to share as well. We start with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here. And I brought backup today. I brought the Corrections Chief, Chief Quinones, here. I'm going to talk about some of the numbers within our jail later within the presentation this afternoon. But we have some significant challenges going forward, so we'll share bad news first, share good news last. So I might as well get into it and talk about the bad news. Orange County now has a total of 6,056 confirmed COVID-19 cases within our county. Put that number into perspective, that's 554 more cases than we had yesterday. This is the highest number of new coronavirus cases reported since the pandemic began. Going back again to early March or mid-March, it took us nearly a month to get up to 300 plus cases, and now we are seeing triple-digit increases every day. Yesterday, we saw an increase of 345 cases in that one day. That means that in 2 days, we have seen an increase of nearly 900 cases within our community in 2 days. Sadly, also, more people have died as a result of COVID-19. We now have 53 published deaths within Orange County. You're going to hear from Dr. Pino. He's going to tell you that number is likely even higher than the 53 from what I'm reporting at this point. When we talk about these cases, to me, it's a bit real. Even within our Orange County Fire Rescue Department, we have one of our young firefighters, 22 years old, that was hospitalized today. I had the opportunity to talk to him earlier. Not the normal demographic that you think about of testing positive. He was healthy, no known illnesses, but sick enough with the virus that he had to be hospitalized. To further talk about, within the last few weeks, on June the 1st, here in Orange County, we reported that we had 2,031 coronavirus cases. Within that 3-week period of time, we have nearly tripled the number of cases. We've tested over 114,000 individuals, and our positivity rate is 5.3% today, cumulative over time. And on June the 1st, our positivity rate over time was 2.8%. So it too nearly doubled during this period of time. On Tuesday, officials at the Orange County Jail learned that 4 inmates in the female detention center tested positive for COVID-19. That is the first time that we had individuals who didn't come into the jail with the virus who have now tested positive. So our jail is a microcosm of the community that we live in, and so it's really pretty extraordinary. It has been 104 days since we activated our Emergency Operations Center here in Orange County, and so it's pretty extraordinary that it took that long for us to begin to replicate what we see in the community in the way of the virus within our jail itself. And so I asked Chief Quinones to come in so that if you have any specific questions of him about what has been occurring at the jail, he's here to answer the questions. Of those 4 women in the female detention center, all are symptomatic and have been medically isolated at this time. This brings the total number of inmates that we have to date that have tested positive to 5. A few weeks ago, we told you about a former inmate with the Department of Corrections who was transported to the jail. His condition was already known to us at that time. He was already positive when he entered our jail. The jail has had safety protocols in place through the pandemic, which I think is what has kept the numbers down. But when we have new inmates booked every day, when we have staff that works in the community, lives in the community, that interacts in the environment outside of the jail, and they come back into the jail, it's certainly an opportunity there to introduce something from the outside environment into our jail. This is not uncommon. Every correctional facility just about in the state of Florida now has some positive cases within the jail itself. To let you know kind of what we do here, inmates are screened to identify at-risk inmates. Symptomatic inmates are immediately placed in a medically isolated cell. New inmates who are just recently arrived at the jail are placed into designated housing for a minimum of 14 days prior to being placed in the general population. All jail employees and visitors must pass a temperature check. All staff must wear a face mask, and all inmates have been issued protective face masks as well. Staff are working in the affected areas and are issued enhanced PPP during that period of time. So that's the jail. Our goal is to stop it no matter where it is within our community. And so we do that by continuing to test individuals, and once we have tested individuals, we have a body of data that allows us to respond to wherever that outbreak occurs. Let me talk a little bit about the Orange County Economic Task Force. They met this morning. It was supposed to be the last meeting of the task force as we have reopened some of our commerce here within the area, but due to the rise in coronavirus cases, we're going to have to leave our Economic Recovery Task Force in place for a period of time. Some businesses, quite frankly, have not been able to reopen, and we're going to be monitoring the current state of affairs as we are in this phase 2 of the reopening of Florida. We heard from many task force members about the need for more education and compliance with face coverings. I think it was fairly well accepted amongst the various task force members that we needed to make some adjustment here in our community with how we respond to the virus, and they were certainly supportive of the executive order that we put in place. As you know, on Saturday, June the 20th, Executive Order 2020-23 went into effect, requiring every person working, living, visiting, or doing business in Orange County to wear a face mask consistent with the CDC guidelines while in a public place. We've had various questions about that executive order, and our legal department has made some clarifications to the order to include more exceptions. I signed a new executive order that if you have not been provided a copy, we'll make a copy of it for you, or it will be posted on our website as well with additional information that gives guidance here within this community. I signed that earlier this afternoon, and it took effect immediately. So it is in place now to give our community additional direction regarding the wearing of face masks or facial coverings. Dr. Pino will tell you and attest to the fact that when we couple social distancing with the wearing a mask and with the other sanitary protocols and measures that we have within our business community, it is the ingredient that allows us to fight back against the raging virus within our community. Yesterday, the Orange County Board of County Commissioners approved changes to the Orange Cares small business grant program. We have some staff here who can answer any questions that you may have about that. But in order to allow more local businesses to qualify for the funding, you can see on the screen behind me here, we have made a few changes. Companies that have received $50,000 or less in federal paycheck protection loans will now be eligible. Previously, if a company, a small business had received any Paycheck Protection Program loans, they were disqualified. We are now saying that if they are a small business with 100 employees or less, they too will be eligible. Previously, the cutoff was 25 employees. So we have made that modification to allow more businesses to qualify for the $10,000 grants that we are making as a result of the Federal CARES Act funding that we received. So far, we've had over 10,000 individuals of companies register for the program, with over 4,600 that actually submitted the entire application. Over 1,000 applications have been approved to date, and that equates to $10 million in grant funds that will be hitting the streets soon for small businesses here within Orange County. As it relates to the Orange Cares program for individual and family assistance, we've had over 30,000 applications with 11,200 submitted on this past Monday alone. As of June the 19th, 3,500 applications have been processed and submitted to the Controller's Office for payments. The CARES program will be processing another 5,000 applications each week. Testing continues to be in high demand. The regional state-run testing site at the Convention Center tested yesterday the highest number of COVID tests since they began at the Convention Center, and that was 1,426 tests that were administered in one day alone. Of course, that's a regional testing site, so you don't have to be an Orange County resident to go there, and it is fully operated by the state of Florida through the Florida Department of Emergency Management and the Florida Department of Health. Our Orange County Health Services has booked all of its appointments for this week at the Apopka and Zellwood areas, as well as the Legacy Middle School. So far this week, our Orange County Health Services alone has tested 1,600 people. Barnett Park testing last week included, let me just say this, in terms of the testing that was done last week at Barnett Park, nearly 90% of the tests are back, and the average positive rate for those tests are 8.8%. So much higher than what we had seen, that one test site. Next week, our health services will be at Downey Park Monday through Thursday, and if you need additional details, you can go to our website at ocfl.net/coronavirus. Our personal protective equipment for small businesses is going well. The initiative began where we were distributing masks and hand sanitizers to our small businesses. This week we have, within the next few days, over 10,000 businesses have registered to receive additional free PPE. For those who need additional appointments, they too can go to our website at ocfl.net PPE, ocfl.net/PPE. And another bit of good news is that our Orange County Animal Services this coming Saturday will distribute 2.5 tons of free pet food at Barnett Park, and individuals had to sign up for that, and sadly I have to tell you that all of the appointments are completely booked for that, but we'll be there assisting households with being able to feed their various pets. And the Economic Recovery Task Force heard some good news as well today. Earlier today, the NBA and Major League Soccer made announcements that they will be resuming their seasons in Orlando next month, beginning of July, for several months thereafter through October. They will be, the professional athletes, staff, and others will be staying on site out at some of the Disney hotels, and they will be engaged in professional sports games and competitions without fans being present. But the good news there is that we all will get to see the NBA re-engage and Major League Soccer players re-engage, and Orlando will be on Front Street for that. So I think, Mayor Dyer, that's good news for our community. It'll be a fairly sterile environment for those athletes, because in the terminology they use, they'll be staying within a bubble. They will stay on site, they will be isolated, and they will engage in the competition. All 26 Major League Soccer teams will be here, along with 22 NBA teams. They will be playing at the ESPN Wide World of Sports. So, again, that's the good news. I started with the bad news. I ended with the good news. And Mayor Dyer will continue with more news.
Thank you, Mayor Demings. It's now been, if you can believe it, 4 months that our community's been living with the COVID-19 virus, and we continue to see its impact. And you think about what we did in the first 60 to 90 days, we really flattened the curve. We, at one point, thought that we might have to build 2,000 to 5,000 beds in field hospitals. Instead, we were able to flatten the curve to an extent that the positive cases were under 2%, sometimes under 1% on a daily basis. And we opened up into phase 1 and we opened up into phase 2 and suggested to everybody that if we're going to make this work, we need to wear masks, we need to continue to social distance, we need to continue to wash our hands and do all the good hygiene things. And it looked like we were doing okay for a little while, but now we're having exponential increases in positive tests. Dr. Pino will talk about that in a minute, but we've gone from the 1 or 2% to having double-digit increases for, I guess, the last 10 days or so. And that just shows you the science is right. We have to be wearing masks and doing the social hygiene things if we're going to be able to operate in this new normal. And there are those out there that say you have a constitutional right not to wear a mask. I'd say you have a civic duty to wear a mask. You have a duty to the other people in your community to make sure that you don't spread the coronavirus and you don't cause our small businesses that have just opened to have to close down again. So I'm calling on all of our residents, not just of Orlando, but Orange County and Osceola County and Seminole County, do the right thing. Wear your mask, socially distance, wash your hands, and be mindful of the citizens that you're trying to protect. We're only going to get through this if we all do the right thing. Okay, I'm going to update you on a few of the not so great things. We've been having positive tests in the Orlando Fire Department, and we're now up to 86 firefighters who have tested positive for COVID-19. They've been exposed, and they and anybody else that we have contact traced to have been exposed to them are in a mandatory 14-day quarantine. We have tested 95% now of the members of the department, and will continue to partner with Orlando Health to ensure that any other members and any other future exposures are tested. We continue to coordinate efforts between the stations and off-duty personnel to make sure that we have the appropriate coverage, so there's no worry about that. Additionally, last week I let you know that 2 of our Orlando police officers had tested positive. Since that time, we've had 2 more Orlando Police Department officers. They are also under mandatory 14-day quarantine, as well as anybody else that was exposed to them. So as you can see, as I mentioned, we have to take this virus seriously, deeply seriously right now. And just as critical as it is to being safe and wearing your mask, it's also continuing to help our families and businesses who have been impacted. Today I'm announcing that the city is providing another $50,000 in additional funding to Second Harvest Food Bank to support 4 of our key not-for-profit food pantries, Christian Service Center, Jewish Family Services, One Heart for Women and Children, and Seniors First to help feed our Orlando residents that are in need. And thanks to our partnership with Orange County, we're going to help our business community operate safely. We're going to be able to provide PPE kits for over 200 downtown businesses. Our downtown Orlando team and ambassadors started that distribution, and we will ultimately provide 225,000 disposable masks and 5,000 cloth masks to our businesses and their employees. With that, I'd like to call on Dr. Pino.
Thank you, Mayor. So the presentation today is going to be a little bit of data heavy, so bear with me a little bit. I will try to explain as much as I can. There's going to be also a little bit of a difference with the data that is on the dashboard because this is more up to date. So we want to give you what you are going to see later this afternoon or early tomorrow morning so that there is no question regarding to transparency and availability of data to all of you and our community. So Orange County has 6,476 positive cases. That's the count for a 5.3% accumulative rate. Our recovery rate has decreased to 49% as the number of cases have increased. And we have 56 deaths. I will give you that data as soon as I have it. Important to know is that, and let me see how I can explain this well to you. 58% of all cases that we have since the beginning of the pandemic have been diagnosed since June 11th. Again, 58% of all cases has been diagnosed since June 11th. That is about 3,764 cases in about 13 days. What is interesting about June 11th is that if we follow the pandemic and how it takes about 2 weeks or 3 weeks in some cases to have cases to become positive and show in the data, what happened 2-3 weeks before the 11th was Memorial Day weekend. So since Memorial Day weekend, we have a very, very active transmission in our community. And we have a lot of social activity that had happened since Memorial Day. That is not to say that I've been able to establish causation for each individual to be able to point to a specific event or a specific situation, but it's safe to assume in the data that there is a correlation between those activities that had happened since Memorial Day weekend and the high increase on the number of cases. Another important thing to watch is the data is that, and this is in the last 14 days, so since the 11th, about 60% of our cases are between people who are 20 to 40 years old, approximately. And 41% of the cases are for people who are between 20 and 29 years old. So that's quite young. This data also indicates us that we have the pandemic, and this is for the last 2 weeks, going on the younger population, and the poor health outcomes in orange going on in the older population. The older you are, the more likely you are to have poor health outcomes if you are hospitalized. Another interesting part of our data, I'm going to skip some in the order, is this one. This is the rate, a rate per 100,000. When we were at our highest around week 13, we were at 21 people per 100,000 had been diagnosed with COVID-19 at that day. On week 25, the last week what we have finished, that number is almost 123 people per 100,000. That's an important number to watch. What are the underlying conditions that people who are dying are more likely to have and having the great impact? And it's in reverse order. The hypertension, 69% of the people had it. Diabetes, 52% of the people who had died. And smoking, about 35, and it goes on and on and on. With the fatalities, I want to make a pause here to mention to you the fatalities that we had. Our fatality number 50 is a 40-year-old female, white, non-Hispanic. We don't know the exposure, and we don't know if it had any underlying conditions. This person was only hospitalized for a day. Fatality number 51, 75-year-old female, black, non-Hispanic. The exposure was to a positive person. No underlying conditions that we know. That person was hospitalized also for a day. 52 years old, the 52 fatality, 60-year-old male, black, non-Hispanic, unknown exposure. The person has some underlying conditions, 2 days in the hospital. Fatality number 53 is a 70-year-old male, white, non-Hispanic. We don't know the exposure. He has some conditions, hospitalized for 3 days. Fatality number 54, 60-year-old female, black, non-Hispanic, exposed to a positive person. He had conditions and was hospitalized for 13 days. Fatality number 55, male, Hispanic, 89 years old, unknown exposure, unknown conditions, hospitalized for 4 days. And the 56th individual, 82 years old, female, Hispanic, with another exposure. He had underlying conditions and was hospitalized for 9 days. Although we have to do some analysis, something that pops out of the data is how few days people has been hospitalized. So how ill they are showing into the ER. And that's an interesting observation that we will have to talk to clinicians to see if that's what's happening in the hospital in real time. This is our epic curve of daily cases, and it's going to the roof. And this is our famous epic curve. Don't look at the last portion of the epic curve because the data gets updated automatically. So at the end of the week, it will show the real trend. But right now, that's where we are. And this is the number of cases per week and the percentage that we have increased or decreased when we were decreasing. And this is the data generated at our department, not by the state. And this is a rolling average 14-day of positivity rate. We use it better this way because positivity rate in a daily basis, it has to do more with how many tests you receive. And it could be, delays in the lab, getting the data, or whatever the situation may be. And this one reflects better for if you are managing the pandemic, following the data. And right now, our average 14 days is 11.56%. This is our percent positivity rate per week, and the line indicates the elevation and how steep the curve is. And these are hospitalizations that you asked yesterday for that data. I'm going to provide you with new numbers that I got it while I was talking. While the mayor was talking, I got the new numbers. So hospitalizations have also increased, and the number of total people hospitalized today, as 11 o'clock in the morning, in our county for COVID-19 is 168 people. People in non-ICU, out of the 168, 133, and people in ICU, 35. Now, on June 14th, we only have 15 people in ICU for COVID-19, to give you an idea. Could you show the other data? So this is a dashboard that is not public facing, but we use it and have used it in the past and use it today, because this is the one that we use to monitor the health of our health systems. And with that is to say that although we have an increase in the number of cases that is significant, and there's no way to hide that, it has not impacted the health system in a way that it cannot perform. And we never were at that point either before, but this is what we want to prevent. What we want to prevent by wearing masks and protecting ourselves is the 3 Ws. Wear your mask, wash your hands, watch your distance. If we do that, we will be fine. And that's what we have to do to go back to where we were. So here you have the total number of tests performed, negative, positive results, total tests done from hospital beds, total of death that is reflecting a different number. This is the bed capacity in our county, 4,751 beds. We have 430 beds available, so we have plenty of capacity. And we have about 553 ventilators available today. This is also, we have 66 ICU beds available in the county. We have 10 isolation beds. We have 413 beds, acute beds. We have 56 pediatrics beds in ICU available, and we have 12 long-term care available beds. That's the data that we have. We also have the capacity in this dashboard. It's not showing today for some reason in the connection with the internet, but here you will see each of the hospitals in our system. We show here, you can click and it can give you the inventory of bed and COVID patients for that specific institution. With that, I move it to the mayor and we'll answer any questions that you may have. Thank you.
Okay, I know that much of the data and what you heard should be sobering to you, and hopefully it's sobering to persons in our community, which reinforces the need for us to wear the mask and do all the things that we're asking people to do. So with that, we're going to open it up for any questions. I would remind the Spanish-speaking media, if you have questions that may be in Spanish, we have Dr. Pino who can respond, and we also have Ms. Ilia Torres, one of my special assistants, who will translate for me if there are questions that you may have. So there's a microphone that is going around, and we ask that you wait on the mic before you ask your question. And so, not sure, there it is. Okay, there's a question.
This question is for Dr. Pino. Dr. Pino, Eric Sandoval with News 6. Can you talk about testing? Because per what you just said, we're seeing an influx of cases, and we're getting reports that people are starting to wait in line at the Orange County Convention Center at 2:30 in the morning in order to get their COVID-19 test. And they're waiting in line for 5.5 hours. Is there any consideration of adding more testing through the Department of Health?
Yeah, so remember the Convention Center is the Department of Health testing. And what the Department of Health have decided to do there is to increase the testing capacity from 700, that they have a cap at some point, to unlimited what they can do in the number of hours that they are open. And yesterday was a setting record number of tests that they were done. Now also, True Health and all the partners in the PCAN network are providing testing. And also, remember, your primary care provider can order a test, and it can be performed by any of the commercial labs. Now, to that end, do we have the capacity to add more testing? We could add about 500 additional tests a day, very quick. What we are trying to do, the state has set up a quote of about 2% of the population of any county should be tested every month. For that is an increase for us. It's about 1,000 tests a day. We are well above that. We are doing in some cases 2,000 tests a day. So I think there is capacity in the system to do more testing, but people are going to the place that they know are more familiar with. So if we see that is real need and things continue to be this way, we will increase our capacity for testing. We'll go back to our roadshow and have it rotated through the county as needed. And actually, I have instructed our staff to be ready in a drip of a dime to be able to do it. So we have that capacity. We are observing because we also have HIV, other sexually transmitted disease outbreak. I was talking to you about how concerned we are about measles because our immunization rates have dropped for measles to a point that is dangerous if we have an outbreak of measles. And we are going to concentrate and try to prevent an outbreak within an outbreak. And our efforts are going to be for our agency here locally to be concentrating in increasing immunization rates, preparing our school system for reopening, increasing flu vaccination, and if we have to, we will increase capacity for testing.
Por aquí Michelle Félix de Telemundo 31. Una pregunta, se está pidiendo en realidad que las personas continúen, se cuiden tanto a ellos mismos como los demás con las máscaras, pero hay muchas personas en realidad que no la están usando. ¿Qué se va a hacer en relación a esto? Porque es una orden ejecutiva, pero tampoco se puede obligar ni se va a poner una multa. Entonces, ¿cómo vamos a lograr que en realidad las personas usen estas mascarillas?
So the question in Spanish was that a large number of people, or a significant number of people, are not using masks. What we are going to do if it is no an enforcement component to it. La respuesta es, mira, no podemos forzar a nadie a hacer nada. Hay 1.500.000 personas en el condado. No tenemos 1.500.000 personas para estar mirando quién usa y no usa. Yo pienso que la acción ejecutiva de por sí es un enforcement para usar las máscaras. Y también provee a nuestros residentes con una importante herramienta para decir donde quiera que van y no encuentran que están usando máscara, los restaurantes, los bares o el lugar de trabajo, es mandatorio usar máscara. Y también, pero yo he visto, sinceramente, este fin de semana, y esto es solamente en observación, he visto un incremento en el número de personas que están usando las máscaras. Y también he visto muchos negocios, todos los que fui este fin de semana, que en la puerta dice, no entres si no tiene una máscara. My answer was that, yes, it's not possible to enforce for every single resident of a 1.5 million people, 1.3, whatever our number may be today, to enforce that everyone is using a mask. But the executive order by itself is an enforcement tool because it provides our residents with the ability to demand from places of business and other places that they may visit, even from the peers or even from others, the ability and the necessity to have a mask on. But also, I was saying to you that, but this is just anecdotally, but walking around and being around this weekend, I have seen an increase in the number of masks used. I don't know if it's just hopeful thinking, but I have seen it. I think I have seen it. Thank you. Gracias.
Hello, Alibet Suárez para Más 100.7 FM. Mi pregunta es para el mayor, Jerry Demings. Básicamente, con estas nuevas cifras de seguir incrementando estos números, ¿se podría considerar, ustedes estarían considerando regresar en algunas instituciones, en algunos negocios a la fase 1? Esta sería mi pregunta.
Given the increase in numbers that we have seen throughout as a trend, have we considered return certain industries or businesses to phase 1?
Where we have seen businesses that have been primary offenders of being non-compliant, we have used every option that we have, and primarily the enforcement has been done through the Department of Business and Professional Regulation for those businesses.
Cuando hemos visto casos de negocios que no están acatando las órdenes sobre el uso de mascarillas, hemos utilizado las herramientas que tenemos a nuestra disposición con relación al Departamento de Regulación de Licencias Profesionales.
And it has been reported that for those bars or restaurants that were primary offenders, the Department of Business and Professional Regulations suspended their license to operate.
Así también hemos recibido reportes que aquellos que no han estado en cumplimiento, el Departamento de Regulaciones ha suspendido sus licencias.
If we receive complaints about other locations, then we will look to the breadth of the enforcement options that we have to address those specific businesses.
Si recibimos quejas adicionales, veremos el alcance de las herramientas que tenemos a nuestra disposición para hacer cumplir esas órdenes.
Okay.
This question's for Dr. Pino. Lauren Seabrook, Channel 9. It's actually a two-part question.
It's never a one part.
I've been good lately. The first question is, how many people, do you have a percentage of how many people are asymptomatic versus not? Do we have a surge of people getting tested because of maybe contact tracing and letting people know, hey, you need to go get testing? Or are all these people that are coming in actually showing symptoms? Second part of that is, do you think wearing masks will be enough, or do you think we're on the track to have to go and shut down again?
On the first one, the last time that the data was provided to me, maybe a week ago, the percentage of asymptomatic people was about 20% of all cases that we were seeing. That can be recalculated, and we can give you that next time to most exact figure, but it's about 20. In other markets around the country, it has been as high as 25, 30%. So it's a significant number. The second part of the question, do we need to close? I don't think, I'll go back to some more restrictive approach. I don't think that the debate here is wear mask or close. I think the dilemma here is open and do what we are telling you to do, because it's a reason for that. It's not that the government is trying to impose masks on anyone. They are not that comfortable sometimes, depending on the type. But you are protecting someone. You are showing respect for someone's life. As I said before to you, we have seen a dynamic of intergenerational living, where the seniors are households where we have younger residents have been exposed to COVID-19 by those younger residents. And it is important to protect those people. I think that if the thing continue to go this way, I think the change that we will have to do is also in the way that we strategize and how we approach the pandemic itself. But that's more of a national discussion than just Orange. But at some point, the reality in a pandemic environment is, do we let it burn? And that's the expression that people have used, retrieve a healthcare and provide to the most important and vulnerable people during the pandemic, which is our seniors, homeless, people with pre-existing conditions, healthcare workers, and first responders. Those are the dynamics in society that need to continue to operate in a healthy environment so that the society can move forward in this case. But I don't think that we need to close anything. What we need to do is to wear masks. It's enough? It's not enough masks. What you do is you build layers of protection so that you can catch the virus and stop in different ways. And that's by placing distancing. That is by wearing a mask, and that is by washing your hands. So if you put all these layers in place, it will work. We've seen it before. We were at 30 cases, 29 cases daily before, and that's very manageable, and that's what we want to go back to.
The one thing I wanted to add, Lauren, to your question is we took a measured approach here to making this mandatory and in some ways nearly voluntary. The next step could be to add additional penalties for failure to wear the mask and follow the directive. We've been intentional about not doing that at this point. But in terms of the public policy, if we don't see where we're gaining compliance, then I'm going to make an adjustment, to gain the kind of compliance that we want to see within the community. Yeah. All right.
Questions for Dr. Pino. Danielle Lama with Fox 35. As you showed us, the hospitalization numbers are looking okay for Orange County right now. Is that still because we have younger people that are getting the virus? And what are your concerns with hospitalizations as we continue to see this trend of increasing numbers?
So the hospitals are reporting that people that are getting hospitalized are younger. But not younger in the sense of 20s, although there are a few. The mayor just mentioned one of our first responders that is in his 20s. There are some, but instead of seeing people in the 70s or 80s, they are seeing people in the 40s and 50s, and that's what hospitalization are getting younger. The concern is now that we have a 20-year-old individual who had fed, good health, and is going to perform well. For the most part, most people do perform well. The issue is that individual doesn't live in isolation. Those individuals have a grandmother, a grandfather, someone in a convalescent home, someone living at home with them, someone in a long-term facility. And it will take just a few days for this to jump into older communities where it can really, really be very damaging.
Okay. Questions?
Yes, I have 3 questions. First 2 for Mayor Demings. This is Sharon Stone with News 13. They're both related to the economy. Could you speak to the announcement by Universal with the layoffs? And the second part would be, can you also speak to why you are expanding the funding for the CARES Act to more businesses?
We have an adequate amount of money to be able to assist additional businesses. And given the experience that we have now of better than a week of making the funds available, we intend to expend those funds. We have until December the 31st of this year to expend all of the funds that the federal government provided to us through the CARES Act. And so we don't want to leave any money on the table. So we believe that if we expand the universe of eligible businesses, we'll be able to award more funding. So that's why we made the adjustment there. Now, the other question you asked was?
Universal layoffs.
Oh, the universal layoffs. While we have reopened our economy, it's still not back to the level that it was pre-pandemic. And as a result, businesses are going to have to make business decisions for their own financial health. And I believe that's some of what you have seen at this point with Universal. We're going to likely continue to see businesses that make adjustments, and there will be significant numbers of individuals who will be underemployed or unemployed as a result of the current experiences that we're having. It's not unique to Central Florida or Florida. It's happening all over the country. It's happening really all over the world. The world has not recovered yet because there's still no known vaccine or cure for the virus itself. And so we're just making an adjustment as human beings to live with it. And so I understand what Universal did. They still have a significant number of employees who are working. We're excited about the announcement that has been made about the NBA and the MLS going out to the Disney properties because that puts people back to work. It also provides, I think, the sports entertainment that we kind of want to get away from the ugliness of a pandemic that we live within. And those professional teams, no doubt, will begin to have a positive impact on their bottom line, their financial bottom line, by playing the games and having those games televised. Okay.
Good afternoon. I have one question coming in from Asher Wildman with News 13. It's for Dr. Pino. Do you know or can you report how many children are getting tested for COVID-19? If average age is getting younger and younger, is this a potential circle of exposure? Kids come home and give it to parents, then parents spread it. Ideally would like to know kids ages 5 to 17, since August is around the corner for back to school.
So all the ages, I don't have any in front of me, were the ages of the infections that we have. I don't know how many children have been tested. I can have that question answered later. With regard to, we have met briefly over the web with the superintendent of schools, and we are going to work with them. And the state has also started to develop and has been put out some guidelines to increase. But the Children's Hospital is testing for children, and we are planning to have that ability to do so. The issue with testing children in a mobile environment is that you need the consent of the parent, and you have to verify that the parent is the person that is there and saying that it is. So yes, we are planning to increase testing for children, and again, primary care providers can order testing from the commercial labs, and those are available to individuals as well.
Okay, I think that was all of the questions that we have today. Thank you all for joining us here at this press event. We'll come back to you in the very near future with an update. Again, if we do have a couple of our commissioners here, Spanish-speaking commissioners, if there are any questions of any of us, they're available for one-on-ones. All right, thank you very much.